let's talk more broadly about the root cause of these skyrocketing healthcare costs for a lot of Americans, and that is because the premiums that low-income Americans were getting are now expired. This is as part of Obamacare. You told me here in November that the president is laser focused on this. So far, we've only seen a framework of a plan. What specifically is the president doing right now through the fundamental problem with insurance costs to lower those costs?
All right, folks, let's talk about what you just watched, because buried inside that interview with Dr. Mehmet Oz is something the media really doesn't want regular Americans paying attention to. First off, notice how the interviewer keeps circling the same talking point. Healthcare costs are high, premiums are high, where's the plan? And that's a fair question because for years, politicians have talked around the problem instead of actually addressing it.
The costs are still high. So my question is, just can you give me one specific example of a solution that the president has put forward that is lowering the cost of health insurance and healthcare costs beyond prescription drugs?
There's something called a CSR, which is a way of making sure that insurance works more efficiently. The Affordable Care Act is a good example of this. These were in the original Working Families Tax Cut legislation, was taken out by the Democrats for reasons that are unclear to me because it seems like it's better for everybody. It will drop premiums 10 to 11% across the board. So I'm giving you a insurance hack that works to reduce insurance premiums for the American people 10 to 11%. We want it back in. We want that to, it was originally designed and supposed to be in the Working Families Tax Cut legislation. We want that back. The other thing, Dan, is transparency is vitally critical. When I'm called into the operating room, and I'm a surgeon, as you know, the first thing we do, if I'm helping a colleague, is we open the wound and put more light in the wound. Transparency. We got to see what we're doing. Most Americans don't really know what they're paying for. Their pharmaceutical prices are an example, but when you go to the hospital, you don't know what it's going to cost you.
Right.
You would never go to a grocery store and put things in your cart and not know what they were going to cost. And that's what we ask the American people to do. And of course, because of that, companies jack up the price because you're not aware, you're not an informed consumer. We have to drive transparency to the system. So we use our biggest ally, the American people, to judge whether the prices are worth it or not.
But here's where things get interesting. Dr. Oz comes in and basically says, hold on a second. The sky didn't fall when enhanced Obamacare subsidies expired. Remember all the fear-mongering? 8 million people will lose coverage. 10 million will be kicked off insurance. Healthcare will collapse. None of that happened. Enrollment stayed roughly the same, which tells you something very important. Throwing more taxpayer money at subsidies is not the solution. It never was. And then Oz drops what he calls an insurance hack. And honestly, that's the most refreshing thing I've heard out of Washington in a long time. A real, specific policy that could reduce premiums 10 to 11% across the board. Not a slogan, not a vague promise, an actual mechanism. Cost-sharing reduction, CSR, is something that was originally designed to make insurance work more efficiently, not expand government control. And of course, Democrats ripped it out. Why? Because it didn't grow bureaucracy. It didn't make people dependent. It actually lowered costs. That's the key difference here. The left's answer to healthcare is always the same. More spending, more control, more rules, more opacity. Trump's approach, and Oz explains as clearly as the opposite. Efficiency, transparency, and consumer power. And the transparency point? That's huge. Oz nails it when he says you'd never go to a grocery store, fill a cart, and only find out the price after you leave. But that's exactly how hospitals operate. Hidden prices, surprise bills, no accountability. That's not compassion. That's exploitation. Transparency scares the system because it empowers you. And when Americans can see prices, competition kicks in and costs come down. That's how real markets work. So let's be clear. This isn't about gutting healthcare. It's about fixing a broken system without turning America into a government-run nightmare. Less fear, less bureaucracy, more honesty, more control for the American people. That's not radical. That's common sense. And frankly, it's long overdue. If you agree with that, hit like, subscribe, and share this video because common sense only wins if we keep pushing out there. And I'll see you in the next one.